Isatuximab is becoming the standard of care in many settings in multiple myeloma, from frontline to relapsed and refractory population. It is a new generation anti-CD38 monoclonal antibody, and we know that in this moment we are obliged to perform intravenously the administrations of the drug. OBI is a revolution. It has been tested inside a double clinical trial, IRAKLIA in combination with pomalidomide and dexamethasone, and IZALCO with the carfilzomib dexamethasone. Both the trials were in relapsed refractory setting. They were studies of not inferiority, and coming from the data in terms of effectiveness, it is absolutely the same intravenous versus subcutaneous, but in terms of tolerability and the patient-reported outcomes, the OBI is a great addition, a game changer of isatuximab-based treatment. This is like a small button that we put on the abdomen of the patient. Intra that we inject the drug, and this is safe, this is simple, so simple that inside the IRAKLIA clinical trials there was a small cohort of patients that administered in domestic setting. We had the possibility to take the anti-CD38 treatment at home, and I think this is a revolution in the revolution for applying this revolution to also other combinations, because we know that recently isatuximab has been approved also in elderly frontline setting, in transplant-ineligible patient. ISA-BRD is an exciting solution. The idea to perform subcutaneously with a so safe device is something that had the possibility to treat many patients with that. And also in terms of the possibility that in frontline transplant-eligible setting, thanks to GMMG HD7, ISA will be approved, I think that we can switch all the patients to subcutaneous administration. The patient-reported outcomes are one important point, but also the feedback deriving from the hospital staff is really important, and particularly the nurses and the physician that had to manage this patient are particularly happy to not inject directly on the skin, but injecting into the tool is something that helps also some patients that are afraid by the injection itself and in general don't want to be cut so many times according to administration of the drug. I think that in this moment we have so many novelties about myeloma that this is a way to think also the quality of daily life of our patient, and not only to improve the effectiveness of the triplets, quadruplets and all the drugs that we have available. So in next future I hope that more solutions like this will be available to improve the life of our patients.